sporting events, plays, musicals, graduations. And for that, I am very, very sorry. I'm sorry that they have missed this. But we're proud of all those who graduated this year. And we're proud, Fran and I are particularly proud, our grandson Brian, who just graduated from high school. I'm proud, we're proud of his grit and his determination. He kept continuing to train for the 2 mile, despite the track season coming to a premature end. Last week, his fellow teammates and friends lined a track in Cincinnati to watch Brian run the 2 mile, and he did something that's, I imagine, quite tough, and that is to run with nobody else running. Brian's time was 9 minutes, 31 seconds, 24, 9:31:24, and so that was a excellent time for him. I think it's his best time, and I think he is fifth of all-time leaders in his high school. So we're proud of Brian. Congratulations also to our 3 grandsons, David, Jacob, and Matthew, who graduated from Miami University, and also our close family friend, Cecilia Comerford, who also graduated the same day from Miami University. Fran, I also want to congratulate our friend Caroline Schinkel, who graduated from Harvard Law School, and congratulate family friends Abigail Sheridan and Eva Sheridan, who were co-salutatorians, graduating from Cedarville High School, along with valedictorian Logan Brenneman. And finally, we congratulate our family friend Gabe Caudell, who graduated from Greenview High School. And to all of your children and grandchildren and friends who graduated from high school or college this year, graduate school, congratulations. Congratulations to all of you. You ran a great race. You made it. At the beginning of the pandemic, we prioritized our limited testing availability to ensure that our sickest patients and their caregivers and first responders were able to receive tests. We progressed about who can be tested. As more testing became available, we've added more and more groups of people, those in nursing homes, those with underlying health conditions, those with symptoms. We continue on that path today. Today we're expanding testing to include anyone in the state of Ohio who wants a test. Let me repeat that. Anyone who wants a test in the state of Ohio can now get a test. We very much had a scarcity, kind of a scarcity mindset, and we still are working to expand our capacity. But we are making progress. And so we want everyone to look at this. I know we've emphasized a lot that they were restricted, but now what we're saying is it's open, and we would encourage you, if you want to get a test. Testing is a very important weapon in our arsenal, and we continue to wage war against a very real enemy. So starting today, if you'd like a test, you'll be able to get one. For example, if you've been around a lot of people and you're worried that you may have contracted the virus, worried that you might be exposed, you could get a test. Maybe you've spent time around someone recently who is sick. Maybe you've even taken care of them. You can get a test. So we're encouraging anyone that wants a test to talk to their health care provider or contact a testing location to arrange a test. By understanding who is sick, whether they're showing symptoms or not, we're able to better prevent the spread of COVID-19. You see the map here on the board. As we announced recently, we added an interactive map to our coronavirus website. So you can go on our coronavirus website and you can see locations of where you can get testing. This map that is up there right now shows testing locations across the state for retail locations, CVS, Rite Aid, Walmart, Kroger, Walgreens, The map also includes community health centers that you can contact to determine where their tests are being performed. So on this map, what is blue is the community health centers. They are not all of them are performing tests at that location. But if you contact any of them, they can tell you where the nearest one is that will be performing tests, and they can tell you when those tests can be performed. You can call ahead, or you can click on the links to learn about each testing site's testing procedures. Now, we're going to continue to add to this, and we're encouraging anyone who is out there, whether it's a doctor's location, any other place that's doing testing, to let us know so we can add to this list. These organizations and retail sites are great partners. We appreciate the work that they're doing. In fact, CVS announced they're adding 7 new Ohio testing locations beginning tomorrow. So we thank all our partners for expanding access to COVID-19 tests. Today I'm announcing we've added 2 new features to the map. First, we've added a form that providers can fill out to let Ohioans know that they are providing tests. The form is on the web page right above the map. Fill it out and we'll add you to that map. In addition, we've added pop-up testing locations. Our Minority Health Strike Force has teamed up with the Ohio Association of Community Health Centers and our Ohio National Guard to offer pop-up testing across the state, and this will begin tomorrow. These are the locations for tomorrow, and these are in Columbus. Thanks to the help of our local partners, Primary One and Heart of Ohio Family Health, there'll be 6 pop-up locations around Columbus where anyone can come and be tested. We picked these locations to make it easier for those living in underserved areas to access a test, but anyone can come and be tested on Friday, tomorrow. Those 6 locations are listed on the website. And I know from talking to the mayor, Mayor Ginther, that they have other sites and other locations as well. These temporary, what we call pop-up sites, will be available all over the state. So watch for the locations. But in the coming weeks, we'll have more pop-up locations in Cincinnati, in Cleveland, in Portsmouth, Dayton, Xenia, Columbiana, and in Akron. And we'll have those. We'll try to notice on this press conference, but also that information will be available on our webpage. We're going to continue even after that to add more locations and more sites, and we again appreciate the great work of the Ohio National Guard. The website, again, is coronavirus.ohio.gov, coronavirus.ohio.gov. You can click on testing and community health centers to find those. Again, COVID-19 testing is now open to everyone in Ohio, even if you're low risk and not showing symptoms. We want those who want to be tested to be able to get tested. By knowing who has the virus, we can better protect the vulnerable and work to stop its spread. Although we've never closed our churches, our synagogues, our mosques, or other places of worship during this pandemic, they've not been subject to any orders issued by me or Dr. Acton or this administration. We do know that most of them stopped holding their traditional in-person services and found other ways to reach out to their congregations. They've done it by broadcasting online, they've done it on Facebook, even by holding drive-in services. They used their creativity and made these important decisions to protect their members and the communities where they serve. And for that, we are very, very grateful. And as I think I've indicated before, our friend Father Tom Hagen, who runs the Becky DeWine schools down in Haiti, long time friend, has been doing Mass on Sunday, and we've been able to participate along with people from Father's Life all over the country and all over the world. So we're very grateful for that. Over the past several weeks, we know that churches are starting to open up. And so just as we did with industry and outdoor activities and entertainment, we put together some suggested best practices. Again, they were never closed. We're not mandating anything. but I know that people go to church, people go to synagogue, the mosque, people go to worship. They want to do it in a safe way, and they want to protect themselves, but they also want to protect their family members and other people who are in the congregation. So these are just suggestions, not requirements. Some of these suggested best practices include having families sit together, and then there be space between each family grouping. Encouraging members to wear face coverings, eliminating the touching of common surfaces such as the collection basket, hymnals, as much as possible. So this guidance can be found, again, at coronavirus.ohio.gov, coronavirus.ohio.gov, and will be shared on our social media pages. Lieutenant Governor.
Thank you very much, Governor, and good afternoon, everyone. We want to talk a little bit about the economy and the job situation in Ohio. As we've learned to manage through this COVID pandemic, Ohio's economy has safely and gradually reopened. We've made a lot of progress on that front, and many Ohioans are returning to work. The Ohio Department of Job and Family Services reported last week that there were 35,000, just slightly over 35,000 initial jobless claims that week. That's nearly 240,000 fewer Ohioans filing initial claims than they did during the peak of the COVID-19 outbreak in March. Another positive aspect of this is that Ohioans who've been unemployed more and more of them are heading back to work, as they said, but for the sixth straight week, renewals of unemployment claims have declined. Last week, nearly 247,000 fewer people filed for continued insurance than they did during the late March peak. So we have some good momentum going as we reopen. People are going back to work. The economy is beginning to move forward, pick up some steam with rehiring, and it's a welcome trend. And along those lines, we have some good news today to announce of some seeds that we've been trying to sow for quite a while. As we went to London last year, I led a delegation to London along with some folks from Cleveland, Jobs Ohio, the Canton area, and Southeast Ohio, where we courted the London Stock Exchange to move its America's headquarters to Cleveland. And we were successful at being able to do that. So now the London Stock Exchange headquarters with an Ohio connection is beginning to support our ongoing efforts in Ohio to help business get access to capital and the investment they need to grow and create jobs. One of the groups that accompanied us on that was the Stark County Minority Business Association, and the governor and I are very proud to have their continued involvement in this effort. And so today we are announcing, Jobs Ohio is going to be announcing in partnership with this effort, 13 minority-owned businesses in Stark County will be participating in the London Stock Exchange's Elite program. And that is great news. We want to connect them to both talent and capital and global markets. This is a world-class program with expert consultation on strategy, marketing, risk management, and talent development. And so it's a positive sign that one of the things that we had worked on pre-COVID, that we had secured for Ohio, is now beginning to make these investments and start helping to grow businesses in our state. And we greatly value that partnership with the London Stock Exchange and the Global Elite program. Additionally, I want to announce that the Ohio Department of Job and Family Services is receiving a training grant of $8.5 million for employment recovery and under the National Dislocated Worker Grant to help reemploy individuals who lost their job during the pandemic. As we know, many employers, many people may not have the same jobs that they had before. Some of those jobs will go away permanently, but we also know that there are many employers who are adding jobs as a result of what's happened. So we want to help those individuals who may have been displaced get the training they need to begin to take these new opportunities, to tackle these new opportunities. So ODJFS will work with the Governor's Office of Workforce Transformation to facilitate this grant program, and we will distribute it locally through our local workforce areas, and they will do outreach to employers to let them know what services are available for individuals who are laid off, either permanently or temporarily as a result of the pandemic. And the services that will be provided under this grant are on-the-job training, customized training, skill upgrading, supportive services, and access to personal protective equipment so that the training can go on safely and the employ of those people can proceed. Funding. We hope this funding will help jumpstart employers who are trying to hire people, people who are looking for jobs. And look, what we experienced pre-COVID was a very dynamic economy where technology was changing the nature of our workforce. We know that as we've watched things like telehealth, distance learning, distance working develop, and more technologies continue to be developed to address distance learning and working issues, that with these changes in the economy, we have to upgrade people's skills. We have to help them get prepared for what's next. And these funding and resources are available for that. And the Department of Job and Family Services will soon be announcing the details on their website. But we will be proactive with this. We will be reaching out to employers. We will be reaching out to people who've lost their jobs to help get them trained, to get the workforce that employers need, and to put people back to work and continue to build momentum in this economy, which we're beginning to see the signs of happening. So these are all reasons to be optimistic about what the future looks like, and excited to offer a little bit of good news today on this beautiful Thursday. Governor?
Governor, thank you very much. When I was elected governor, I knew that I wanted to pick someone to head the health department who had a real passion for public health, someone who had a public health background, and someone who had the ability to talk to the people of the state of Ohio in a candid way about health issues. Had no idea, of course, that we would be dealing with the coronavirus. We interviewed some great people. On February 26, 2019, I was able to announce that Dr. Amy Acton had accepted my invitation to become the Director of Health in the state of Ohio. With her leadership and help in the first year, we focused on some very important things. Lead paint poisoning, infant mortality, youth homelessness, suicide prevention, and just really the modernization of our public health system and a number of other issues. When the coronavirus hit China and we started seeing this on TV, Dr. Acton started talking with me about that. Her wise advice and counsel and her relationships with other doctors, other experts around the country and around the world have truly been invaluable, and they have helped us get through this, at least get through the first part of this. While the decisions were always mine, her counsel has been superb. And